listener, Sal here.
With Rachel.
And we are
the Plastic
Police. So today we're going to talk about Botox and fillers. I feel like people still don't know what Botox and fillers are, and I want to debunk the myth and give people the facts of what Botox and fillers really are.
And they're so different, but they work so nicely together. They kind of complement one another.
Absolutely, absolutely. So a little bit about Botox and fillers. There's a big line of them. Here we have Juvederm, and over there we have Restylane, and we have Botox, and we have Dysport. So Botox and Dysport, there's Botox, there's Xeomin, there's all kinds of neurotoxins. These are neurotoxins.
Right.
And it comes in a dry form, it's liquid, and that is injected usually into a muscle to prevent movement. And what that does, it softens up the skin, it softens up the muscle, and it gives you a more refreshed appearance.
Right.
Now fillers is something very different. Filler is a gel. It's hyaluronic acid. I can never say it right.
Yeah, it's something our body naturally produces, so it's absorbed into the body over time. Fillers can last anywhere from 4 months to 2 years, sometimes even longer, depending on which filler you use. And sometimes the way I explain to patients, although I'm not an injector, right, is the different molecular structures of fillers. So they are different. Some are soft and flexible, some lift and contour, or even can mimic bone structure.
Absolutely,
right?
Absolutely. And fillers looks just like this. It comes in a syringe, and this is 1 milliliter. So 5 of these actually equals 1 teaspoon. So whenever I inject fillers, people are like, I don't want to look plastic or overdone. And we actually have some good before and afters, or even just afters of some really bad fillers. And this is not the way you guys are going to look afterwards, people. It's I take a very conservative approach. So here we actually have a woman, and what do you think about her face, Rachel? Botox or fillers?
You know how we have the giveaway, what makes your heart race? This makes my heart race with anxiety. I think sometimes with fillers, certain people or certain providers let patients get really out of touch with what they actually look like. I think most people don't want to look like this, right? Right. And I think maybe sometimes patients get a little too trigger happy and lose touch with what they actually look like to the rest of us. So hopefully most providers are not doing this to people.
Yes. So this guy, bless his heart.
Yeah, you know, like again, just out of touch with what he looks like.
And mind you, this is not, I don't think this is just one treatment of fillers. His lip fillers, his lips are obviously that big because he has lip fillers. It seems like he has a little bit of cheek fillers as well.
Yeah,
and
a little bit.
You can't tell if he's had Botox or not because there's no animation going on here. And typically Botox is injected from the eyes up to the forehead to relax those muscles there.
Right.
And here's another one, really bad, overdone fillers.
Not a good angle anyway.
Yeah, it's not
Poor
a good
honey.
angle. Yeah. So it seems like she has like cheeks and cheek fillers and lip fillers, and a lot of people might look at this and be like, oh my god, she's had so much Botox done. And it's not Botox, you guys, this is all filler. So think of filler fills areas where there's loss of volume.
Right, or there should be loss of volume.
Right.
You know?
And now I love Madonna, but I feel, I don't know if she had like an allergic reaction to something when she stepped up to the red carpet in 2017. But once again, it seems like she had a lot of cheek filler filled, and
or maybe she had just gotten filler done and maybe had some swelling too, or like a lot of swelling.
I can't tell, but this is another example of the fear of why people come to me and they're like, I don't want to look fake, or I don't want to look plastic.
If you averaged the 2 pictures together, you might get a nice result. Like somewhere in between what she used to look like and that youthful contour that she was going for. It just is kind of lost on her in that photo, I would say.
And once again, you guys, this looks more like filler overdone, not Botox. Now, like, once again, we can't tell if she had Botox or not because there's no animation going on.
Because she won't tell us.
She just won't tell us.
She just is keeping
I'll text her
a secret.
later.
Let us know what she said.
I'll keep you guys posted. But thanks for tuning in, you guys. We are the
Plastic
Plastic Police. Ciao. Peace, love.